Ayush Medicinal plants, scientific and analytical studies. I first request our chairperson for today's session, Dr. Malati Shyamala Garu, onto the dais. Madam is a naturopathy doctor, currently working as in charge for Vemana Yoga Research Center. I now request the keynote speaker for today's session, NLP practitioner, trainer and motivational speaker. Welcome to the dais, sir. Sir. Venkatramana sir, మీరు ready kada? Okay. Request Venkatramana sir to deliver his keynote address.
Few. No response. Good evening. I want to listen to your voice. Good evening to all of you. I know you are all eagerly waiting. Some of them who are going to present are anxious when my turn will come. Right? So don't worry. Friends, I'm here in front of you to talk on one of the wonderful topics which I have designed, and I have worked out a mission statement on this. I may not be able to go, but the topic you see, holistic natural development to make India the happiest country by 2047. How many of you want to be very, very happy? Come on, raise your hands. Oh, others want to be happy all the time. That's the reason you're not raising your hand. Is in happiness. 1982, J.R.D. Tata, one of the iconic industrialists, gave this importance of how to live in a holistic manner. Can money give everything? Hello, it's a participative one. 12 minutes I have, come on. Can money give you happiness? No, right? Can position give you happiness? Position, power? No. Now friends, the only thing you need is what I call it as a body, mind, heart and spirit. And the fifth dimension today I am unfolding. This is something absolutely new. Many of you, now friends, what is holistic? First of all, I completed my anthropology and that is what it gave me an understanding. A human being is in totality, right? So the body, mind, heart and spirit complex is called holistic, and that is what exactly we need. If one dimension is overlooked, then we are not complete. The second one, yes, importance of happiness in our day-to-day life. That really plays the role. And what exactly is the presentation? Yes. To the next slide kindly. Yes. The friends, physical well-being. How many of us keep ourselves physically fit? I am 58 years young, not old. My father is 89 years young, right? Even today, I can tell you many of you can't match because he has physically kept himself fit. And how did he do that? A very holistic perspective, right? When I look into his life, everything is in a planned manner, right? He has formed certain habits. So how many of you are ready to form certain habits? Please raise your hands. Right. Because habits is the second nature. Please remember, everything in our world is natural. If you are not able to do that, you are unnatural. So that is where we need to bring in this physical ability. So importance of regular exercises and physical activity. So young friends, I would like to ask, how many exercises, how many types of exercises can we do? Come on, quick. Yoga, walking, running, climbing. How many of us climbed trees in the young age? Come on, raise your hands. Right, very few hands, because we are living in cities. Hello, yes or no? We don't climb. Whereas we come from villages, we used to climb the trees. It was a natural activity for us, right? And going to the lake, right? And so on. Those are all physical exercises. And today we have to tell them, send them to a swimming pool, and so on. So friends, that's where the first one. The benefits of balanced and nutritious diet. The lesser said, the better. I'll tell you only one thing. Is milk important or not? Hello, all of you? Is it important or not? But the cow, the moment it goes about giving the calf, after a certain stage it kicks the calf. It tells, no, don't drink. It's over. Whereas we keep on drinking milk throughout our life. Now remember, friends, not necessary. That's unnatural. I must tell you. Right? That is where exactly the balanced diet starts. We need to understand milk is for a certain period. And mother's milk is the best milk, no doubt about it. But after that stage, nothing doing. We are being unnatural. Right? Will you agree or not? Now let's understand this very clearly into our life. And if we have to bring in diet, yes, we need to follow. Our teeth are not meant to be carnivorous. We are a mix of both, but we tend to misuse our teeth. That's the reason, friends, we are unnatural. Right? Our teeth are not meant to bring like a lion or a tiger. So we need to understand, we need to have vegetative food more and more. Will you agree or not? Hello, all of you. But protein is important, no doubt about it. Let's have it in the quantity which is necessary. Right? So that's where exactly the balanced diet comes. Right? How do you take it? What are the things? Lesser said the better. Right? Because you know better. The role of adequate sleep and rest in promoting happiness. How many of you sitting over here sleep at least 6 hours? Please raise your hands. More than 6 hours? Good. 7.5, 9. But there is a research study that shows we don't need to sleeping 6 hours and still you are fit. Not necessary. Right? That's where exactly. 7.5, 9 is for children and those who are not well. Hello, please understand. Those who are not well can have more than 7.5 hours rest. But for youngsters, all of us, we can have 6 hours and be fit. How to gauge that? Simple one. The moment you hit your pillow, can you? If you are not able to sleep, then there is some sleep disorder in your life. You need to correct yourself. It's a very simple indication. Right? That's where exactly we need to bring in. Third one. Right? Fourth one. Incorporating natural remedies and practices. And that's what we are here today. So, because these are natural methods that have been adopted. To the next slide kindly. Right. Emotional well-being. Now this is what is overlooked in our life. We think IQ is more important. No friends, it is EQ that is more important. EQ really helps us. Today we see suicides in the young. It's not necessary because we are not being able to develop the EQ in them. We are trying to develop their IQ. And that's what has to be altered. We have to make them strong from inside out, not outside in. And that's where exactly the emotional well-being comes. Understanding and managing emotions effectively. We tend to respond, don't respond, right? Always learn to develop the responsiveness depending on the situation, but never react. Reaction should not be there. Remember, you need to respond and you need to know how to measure that. Second one, building positive relationships is a very important part because in life, we live in a society and we need to know how to maintain the relationship with anyone, right? With friends, with colleagues, with parents, with people, our near and dear ones, and so on. Third one, practicing mindfulness and meditation. This is a very important part. Yes, we need to be mindful. We need to be in the present. Either we are in the past or in the future. We are never in the present. Today, the world has changed completely. Mobiles has taken away our life. We are not mindful of ourselves. So we need to develop that emotional aspect. And last one is harnessing the power of nature for emotional well-being. Yes, nature has given so many things for us. We need to understand the importance of how to develop this into our life. Right, coming to the next one. Yes, intelligence. This is what exactly most of our education system looks into, right? And pursuing lifelong learning and personal growth. How many of you want to be lifelong learners? Come on, raise your hands. Yes, that is the one thing. Right from the birth till death, you need to be a continuous learner. Rule number one, this is what I call it as a concept of Japanese called kaizen, continuous learning. Let it not be a full stop at all. Then coming to the second one, engaging in creative activities and hobbies. Keep your hobbies of your young age alive, whatever may be. It doesn't matter. It can be simple drawing, it can be other aspects, keep them alive. because that is what gives spice of life into our thing. Third one, developing critical thinking and problem solving skills. Now friends, this is a very important aspect which is completely neglected. Decision making is a very important part which parents have to inculcate. Teachers have a major responsibility in that. In leadership, this is what I work on. And today on this platform, I would like to tell, we need leadership, right? If we want to make Ayurveda onto the top, I have a plan for that. 2042, I have kept a plan to remove completely the tablets, right? And to bring in natural methods to work out so that we can have a vision statement of 2047 to bring down allopathic only to surgeries, and even Ayurvedic surgeries can move up. Yes or no? Even in Ayurveda we have surgeries. We need to develop that. And it's a very important aspect. Last one, connecting with nature to enhance the intellectual well-being. Now friends, take time out to be with the nature, because that's where exactly. So the body, mind, heart, and the next one, the spirit, right? The spiritual well-being, right? And this is one part which I can tell you, let it not be a show outside. It is more of inside. Spirituality is something inside. You need to be an inner winner first to be an outer winner. So all that you need to develop a certain methods, right? Of doing prayers, reading certain philosophical books, or even following certain methods of teaching that can help you. So friends, exploring personal beliefs and values, this is a very important part, right? Your beliefs are the real part which are the foundation of your life, and values particularly. I'll come back to that later on. Finding meaning and purpose in life. Have a purpose in life. What do you want to be in life? If it is clear, then every day you will enjoy doing the work, right? And that's where exactly. Practicing gratitude and cultivating a positive mindset, right? PMA I call, positive mental attitude. Throw a problem and you must be able to solve that problem, not become part of the problem. That's where exactly lies the key of leadership. And last, connecting with nature as a source of spiritual nourishment. And friends, this fifth dimension is the new dimension. Sorry. Right. Environmental well-being. This is the part. Today we are talking of climate change. Today we are talking of preserving the environment. Why the need has come? Because we have spoiled. We have spoiled by using the fertilizers and pesticides. We are living in a very unnatural manner. We need to take care of the environment, and that's the reason we need to bring in sustainable living environment and harmony. Connecting with nature through outdoor activities, as I told you, right? It's a very important one. Then reducing exposure to toxins as much as possible. The positive impact of eco-friendly practices, whatever they are. How can it come? It can come when only we be the change. So friends, be the change and you will change the world, right? And that's where exactly I would like to end up. Thank you very much for the dignitaries on the dais and off the dais for giving me this wonderful opportunity. Thank you very much.
The wonderful session, sir. I now call upon the students for the poster presentation. So, first Dr. Ajaya, and I will be calling upon the names of the next presenters. All of you please meet me downstairs.
Doctors, good evening. So we are starting with the topic on agro-homeopathy. My topic is effectiveness of ultra-high dilution of homeopathic medicine, Tuja 30, in the management of fungal disease, Rhizoctonia leaf blight, and improving the yield of Amaranthus tricolor. So I am Dr. Ajaya, PG Scholar, Department of Psychiatry, GEMS. Homeopathy is one of the emerging approach in the management of biotic and abiotic stresses in plants. Various studies have shown that homeopathic medicines can alter the biochemical contents in plants. So my study is based on this plant, Amaranthus tricolor, which is one of the most important leafy vegetable consumed and cultivated in all parts of India, especially in southern India. So Amaranthus tricolor, which is widely known as poor man's spinach, is one of the cheapest, most accepted and commercially cultivated leafy vegetable. And now coming about this disease, Rhizoctonia leaf blight. Among the different diseases which is infecting amaranth, not only fungal disease, there are other diseases which can infect amaranth, but among the various diseases, the fungal disease, Rhizoctonia solanicum, is known to be the most devastating disease, threatening the cultivation of this plant, seen especially after monsoon rains. So the characteristics of the disease includes, the disease is characterized by light cream colored spots, as you can see in the picture, on the foliage, which rapidly spreads, causing extensive damage, leading to destruction of crop and thus heavy economic loss to farmers. So this is one of the most devastating disease that affects, and this is the morphological representation of this disease. So what are the conditions which contributes to the spread of the disease is the humid weather condition, which is seen in southern India, which causes a serious constraint for the amaranth cultivation. And the traditional treatment which is done for this disease infection is seen in amaranth is the fungal treatment, which, as we all know, that the chemical control of the disease through the fungicides can cause serious health hazards. So the control of pathogen is very difficult. Why it is very difficult? Because it has the ecological behavior, the behavior of this fungus has extreme broad host range and high survival rate of the sclerotia. The fungal sclerotia they last for a long time, and they are resistant to even heavy environmental and weather changes. So under various environmental conditions, the pathogen infects more than 90% of plants in the field, and causing various economic loss owing to reduction in the marketability of the product. So according to our master, Dr. Samuel Hahnemann, in his words, if the laws of nature I proclaimed are true, then can be applied in all life beings. Therefore, the eco-friendly management of this devastating disease can be done with homeopathic medicine. So this is how I've done this project based on agro-homeopathy. So the objectives of my study includes to compare the growth parameters and yield of different experimental sets, and the second include to show the effectiveness of Thuja oxynalis 30, which is a homeopathic medicine, in the management of leaf blight of Amaranthus tricolor. And the third is to compare the effect of eco-friendly management of the leaf blight of Amaranthus tricolor with the Thuja 30 with that of fungicides. So we are going to have a comparative study between the fungicides and homeopathic medicine. The materials used for the study include the Amaranthus seeds, which is obtained from Agricultural University, and the homeopathic medicine Thuja oxynalis 30 C. Next is the fungal culture, which is obtained from a biogenics research center, which is used to inoculate the plant. Then pharmaceutical spirit, this has been used in one of the sets to exclude the placebo effect of homeopathic medicine. And next, the fungicide used for the study, which is used as a positive control, is copper oxychloride. So the growth requirements, so for this plant, the growth requirements include sunlight. It requires at least 5 hours of sunlight for its proper growth, and the temperature required is 18 to 25 degrees Celsius, the optimum temperature being 25 degrees Celsius. And the water, usually this amaranth is drought tolerant, but for the better growth, we can water twice a day. And the methods adopted for the medicinal application include, so this is how I have treated this medicine with Thuja 30. First is soaking method. The picture is attached, if you can see. The seeds are soaked in Thuja 30, diluted in water. Second is foliar spray method, and the third is drenching method. So soaking method. In this method, this amaranthus seeds are soaked in 5 drops of Thuja oxynalis 30 diluted in 100 ml water. It has been soaked 12 hours before morphological changes that happen after we treated with homeopathic medicine. First is the branching index, that is the average number of leaves per plant, and it has been seen that the plants treated with 3 methods, that is soaking method, foliar spray and drenching, showed better results. and number of leaves were improved. The height was improved, which is treated with all the three methods. And the number of leaves per each set was improved, and the quality of the leaves were also improved. And the analytical report, it's been shown that the ascorbic acid, which is a nutritive content in the amaranthus, was seen more in those treated with the medicine Thuja 30. And carotenoids are also seen in sample 2, which was treated with Thuja 30. So this is the research methodology. Set 1, 2, 3 and 4. First is treated with the fungicide. 2 is those treated in the germinated after soaking. 3 is without soaking, and the 4th is with spirit to exclude the placebo effect of homeopathic medicine. And the subset include the foliar spray, drenching and the combined method, and the results are observed after particular number of days. So this is the methodology in detail. It is soaked and then sown in the seed tray. It is grown and transferred to the field, and the disease is inoculated after 61 days. If you can see, this is how I inoculated the fungus over the leaves, and after that all the leaves got infected with the fungal disease. So this is when the plants were treated with all the three methods,
Right.
which showed improved results.
That time is up,
thank
Dr.
you.
Ajay.
Thank you so much.
And after 8 minutes, the second warning bell will be given and you have to stop then.
Good evening, one and all. Myself, Dr. Amatul Rauf Sadia. I am Assistant Professor in Government Nizamiya Tibbi College. Today my topic is pain management by regimental therapy. In Unani it is known as Ilaj bil Tadbir. So pain. Pain is an enormous global problem which causes inability to work and depression, anxiety in adults, whereas in children it causes disability and poor academic performance. So pain, it is a suffering which has been often used precisely for perception interpretation by discomfort, sharp pricking, all these other types. Pain is usually transitory, lasting only until the noxious stimuli has been removed. So pain can be acute, chronic or intermittent, or the combination. So the 4 largest causes of pains are cancer, that is osteo, rheumatic arthritis, operation injuries and spinal problems. So this is the statistical analysis of the pain by WHO. So on every 3rd Monday in October, so globally it is celebrated as pain. The World Health Organization, which consider that treatment of pain and palliative care form an integral part of the right to enjoy good health. So this day is celebrated against the pain, supporting CDC analysis data in 2019 and 21 says that 20.9% of US adults are suffering from pain, chronic pain, whereas 6.9% are suffering from high impact chronic pain. There is a new guidelines as per WHO in 2020 on the management of chronic pain. Anyone is suffering from pain, what will they take? They will be taking non-opioids or opioids. Okay, I would like to show few of the side effects of this. So NSAIDs, it acts by inhibition of COX-1 and 2, which will be inhibiting the prostaglandin. So inhibition of prostaglandin will give these side effects like GI bleeding, anemia, erosion, all of these things, because it causes inhibition of thromboxane, and gastric mucosal secretions also get decreases with the inhibition of prostaglandin. So these are the few he mentioned in his book that, and in the book Canon of Medicine, that there are 36 regimental therapies. Of this few I have selected which will be relating with the pain, like hijama cupping, as you have seen yesterday a workshop on it, and herodotherapy, leech therapy. Of this I am considering few. Okay, so I would like to talk about hijama. Hijama is a visible full slide. Previous slide.
You can use the point. You can use the pointer there.
Okay. Used. So it is indicated in most of the diseases like durable ajfain, blepharitis, varicose vein inflammation, and mainly for rheumatic arthritis, sinusitis. This is the report of research paper that certain specific reports reveals the leech therapy. So for example, it is a clinical study done in Germany in which leech therapy has shown the medications which having analgesic and anti-inflammatory action. So we'll be applying that on the particular surface which will help in chest congestion, insomnia, and nutul irrigation. We are pouring, as you can see in the picture, we are pouring the liquid on that particular area for a certain time, which will help in removing the morbid materials. Okay, this is the indication of this, and these are the few medicines which has analgesic and anti-inflammatory actions. Thank you.
And all. Myself, Dr. Swati, working as Associate Professor at Gokraju Rangaraju College of Pharmacy, and I am here to present my research work on isolation and characterization of herbal colors and their lake formulations for pharmaceutical applications. So the contents includes introduction, purpose of the study, design of the study, interventions, results, conclusions, and finally references. So coloring agents are most widely used in pharmaceuticals. The main importance of coloring agents is to increase the patient compliance, and by using colors even identification of the formulation becomes very easy. So selection of these coloring agents in the newly developed products is one of the important and crucial step in the pharmaceutical industry. So there are wide varieties of synthetic dyes are available as coloring agents, but still their safety as well as toxicity issues are there. So nowadays, in fact, for the past decade, pharmaceutical industry is moving towards changing its trends and moving towards uses of the herbal drugs or herbal colors as an alternative to the synthetic agents. So by using them, pharmaceutical products were developed. So the red beetroot, which is known as Beta vulgaris, belongs to the family Amaranthacea, which consists of red as well as yellow pigments, which are collectively known as betalains. The red pigments are known as beta-cyanins and the yellow pigments are known as beta-xanthins. These betalain pigments are usually produced in the form of juice concentrates to the food industry. So as per the FDA, that is Food Drug Administration, lakes are nothing but they are the insoluble salts, which are aluminum salts, which are prepared by adsorbing the dye substance, water soluble dye substances by surface phenomena. That means they will be adsorbed on the surface of the aluminum salts by precipitation methods. These lake formulations are basically solid dosage forms, so they offer greater stability when compared with the juice concentrates. So by keeping these facts in view, we made an attempt to isolate safe, eco-friendly and biodegradable natural dyes from the beetroot, and also we plan to convert them into insoluble lake formulations so that they can be used as pharmaceutical excipients. So the research was designed with the following objectives: isolation of betalains from beetroot, and after isolation they will be identified by suitable means, and then they will be converted into lake formulations, and finally the formulated lakes will be characterized by suitable means. So the first one is isolation of the plant pigments from Beta vulgaris. So here the commercially available beetroot, the red beetroot which is locally purchased from Nizampet village market, were taken, they washed properly, and they were sliced, and approximately 100 grams of the material was taken, and it is crushed by using blender using 50% hydroalcohol. Then it is ultrasonicated for 1 hour, then it is filtered through muslin cloth, and we got clear filtrate. This upon solvent evaporation we got the extract, and the resulting the extract was identified through chemical analysis and by UV absorbance measurements. This will be explained under results. And after identification of the betalain pigments, they were formulated in the form of lakes. So for the preparation of lakes, a suitably concentration of the dye extract was taken, and it is dissolved in 50% hydroalcohol. Then it was mixed with 1 gram of the aluminum oxide in order to prepare lake formulation, and from the resulting solution at regular intervals, that is for every 50 minutes, the resulting dye solution was taken, and it is suitably diluted with the solvent, and the absorbance was recorded. And from the absorbance recordings, we have calculated the percentage of the dye which is adsorbed on the insoluble aluminum oxide. And the total 4 formulations were prepared, out of which, based on the percentage yield, we identified
At 7th minute will strike 1 and 1 minute will be there. So 8 minutes total.
Yeah, Professor Gokaraju Rangaraju College of Pharmacy. Today I am going to deliver a talk on the pro-neosomal drug delivery system for the Ayurvedic medicine, which is mostly used in the Alzheimer's disease. Okay, so now these are the contents of my presentation. Nowadays everybody knows Alzheimer's disease is the major problem.
Mic, yeah, sound is not there.
Okay. So, Alzheimer's disease is nothing but a dementia, everybody knows, and after some times patient may lose its ability to speak and all the problems. So, dementia is the major problem nowadays, we know. So, we have used Zanadinadhyam Kashayam for this study, as it is already proved to use in the neurodegenerated diseases. So, we have used the same formulation. Mostly it consists of 14 herbs. It is already proved formulation. Nowadays, most of the Ayurvedic doctors are already using. So, same Kashayam I have used, and we have done the preparation. See here what we have done, neosomal formulation we have prepared. So, what is the meaning of neosome? I will show. So, this is the actual diagram of neosome. Mostly we will have the lipids in this one, cholesterol will be there, and aqueous drug, that is water soluble drug, mostly we will include in the aqueous core. So what will happen, rate of absorption will be more for this. So what we have done in this, lipid we have used, cholesterol, non-ionic surfactant we have used, and some carrier drugs also we have used. Okay, so this is what will happen. Mostly this drug delivery we have prone for the nose to brain delivery. Means directly we will introduce the drug into the nose, through the nose directly it will go to the brain. So whatever effect we are getting, that is whatever degradation will be there in the liver, it won't be there. So directly drug from the nose, it will go to the brain, and very fast you will get the biological activity. So that is only our aim. So whatever this Kashayam we are taking by the oral route, we can directly go give through the nose, and it will directly absorb into the brain. So that is only the main aim of our formulation. So aim of the present formulation, present study is to design, develop, and evaluate the formulation for various studies. So in this we have already used the lipid, non-ionic surfactant, the lactose monohydrate we have used as a carrier. So this span 60, cholesterol and stearyl amine, all these are the non-ionic surfactant we have used. Cholesterol we have used as a lipid, and then solution E is nothing but our Kashayam. So 100 milligram equivalent Kashayam we have taken, already we have mixed with the water, magnetic stir we have used. All these solutions, that is non-ionic surfactant and cholesterol, we already dissolved in alcohol, and drop by drop all these solutions we have added into the lactose monohydrate and Kashayam solution. So what happens, slowly that drug is covered with the lipids as well as to the non-ionic surfactants. So whatever image I have showed, we got like this. So in the aqueous core, directly our drug got entrapped. So it is covered with the hydrophilic covering. So what will happen with this one, rate of absorption through the nose it will increase, and maximum dose we can give is a 200 microliter only. So we want to just decrease the dose and control it. Means slowly drug is diffusing from the formulation into the system. So slowly it will get absorbed into the body. So this is our whole results. So it is very good formulation we found, and as it is a pre-neosomal formulation, directly it will go to the brain. So it will not get degrade into the liver and all. So that is only our main, it is already followed. So that's it.
Have you tried any of the patients?
No, so just formulation we took, and with that we have proved in vitro model.
No, you have mentioned the one slide that cholesterol and all.
Okay.
Because you are putting on Kashayam, how it can be cholesterol?
So sir, actually the only 10 milligram we have taken, and on the animals we tried, sir, rats, but that data I did not add here. So we have tried on the rat with the minimum concentration. So we got good result, but more study we did not do in detail. Only in the rats we have tried whether.
How many rats you have done? Which of the rats you have done? 6,
sir, albino 6. Albino rat 6 animals we have done. So just we have seen whether it is absorbing. So blood we have to withdraw, and 0.1 microliter we have evaluated, sir.
Because the BBB crossing drugs is somewhat some specificity is there.
Yes, sir.
Especially as for the Nasha concern. Because that's why in Ayurveda they have categorized in several different spectrums. Because Brahmana Nasha, Virechana Nasha, and because this Nasha comes under somewhat different.
Okay.
But somewhere Mapana Nasya was mentioned in our science, where the brain has been stimulated in that very fast. So in those aspects you have to be concentrate. Because in the Kashayam form also is good, but how far it is reliable?
Actually, sir, from the pharmaceutical view, we have tried different formulation with the kasham. We have seen just preliminary study we did.
Because
Sir.
Dhanadanyadi Kashaya, usually they are giving internal.
Yes, sir. Yes, sir.
Okay.
Good evening, one and all. To the dignitaries on the dais and my professors below the dais. I am Sara Afrin. I represent Gokraju Rangaraju College of Pharmacy. I do work as an assistant professor there. So today my topic is on nanoparticles. As you all know, nanoparticles have a wide application in our biomedical field, in the pharmacological field, either when you go to textile industry or it is when going to wound healing properties, and also in your food industry, nanoparticles play a major role. While I just tried, there is a small effort from our department for the synthesis of nanoparticles by using a plant extract. So I'll just go with this PPT.
Be asked in that time limit.
Good evening everyone. Myself Leela Madhuri of first year BNYS. Today here I am going to present my poster on immunity. The immunity was derived from the Latin immunitatem, meaning protection or exemption. Immunity is our body's ability to recognize germs to prevent them from causing illness. Today I am here to present the poster on immunity. Immunity, the nutrient-rich diet. Nutrient-dense food contains vitamins, minerals, complex carbohydrates and healthy fat. A diet rich in vitamins and minerals plays a vital role in metabolic activities. Our body cannot produce vitamins and minerals naturally, therefore it is essential to consume them through food. Each food is rich in different varieties of vitamins and minerals. That's why it is crucial to have a variety of fruits and vegetables to get enough nutrients. Yoga. Yoga is the journey to the self, through the self, to the self. Yoga takes you to the present moment and only place where it exists. It enhances eternal happiness and strength. It helps to find inner peace. Rather than doing heavy exercises, yoga and simple exercises gives us more benefit. Quality sleep. Sleep is the ultimate state of happiness. It is defined as one's individual happiness, self-satisfaction with all aspects of sleep, efficiency, sleep latency, sleep duration, and wake after sleep onset. Healthy subconscious. We nowadays are forgetting the graduate and the beauty of uncertainty. There is a hope of everything or matter that happens in life. The hope lies within us, in our subconscious brain. We humans have the ability to heal the body by our brains. We doctors treat patients by motivating and living their inner peace and satisfaction. Natural supplements, products made from plants that is thought to be useful in treating diseases or staying healthy. No other therapist is as beautiful as nature. Love plants and embrace the beauty of greenery around you. I hereby conclude that our body holds up wisdom. Trust in it, learn from it, nourish it, watch your life transform and be healthy. Thank you.
And all. A warm welcome to all of you. And my topic of poster presentation is the rhythm of healing, that is integration of chronobiology in the medical practice. Before getting into the topic, all of us have one common goal. What is that? To lead a long and a healthy life, right? To be precise, to lead a very healthy life at physical, mental and the intellectual level. So, to attain that, what we have to do, what we have to maintain it, and what is the things to be maintained, to be synchronized with the environment, and what are the things to be adapted. So, and these are the particular rhythms in our body. There are some internal biological clocks which maintain this one, which maintain the rhythmicity and synchronization, which keeps us in pace with the environment. There will be a continuous change in the environment, seasonal changes, annual changes and all that. And that particular things are called as a biological rhythms. And that study is nothing but a chronobiology. Chronobiology is nothing but it is a study of the biological rhythms, and it manifested in the nature by day and night and low and high tides, and in the human beings it is affected as a physical activity, intellectual and the mental freshness, etc. So, and this particular concept is, it has not been a new one, it is existing since the ancient times, and Halbach was one of the person who were considered as the father of chronobiology. And what is the mechanism behind these biological clocks? So there is a master clock which lies in our body, that is within the suprachiasmatic nucleus, and it receives the information through the retinohypothalamic tract, and it has its effects at all levels. Chronobiology can be explained in the level of health, in disease and in the curative aspect also. So in the level of health, it has its at particular time we have the physiological changes, biochemical changes and everything. So this can be manifested in case of the health, and if it is altered, what happened? What is the reason for the alteration of this one? What is causing this circadian malalignment? So that is nothing but our modern lifestyle. So this is due to the extended light hours, that may be due to the night shifts or the day shifts and the irregular food habits, anything that may lead to the circadian malalignment, which leading to the clinical manifestations, that is nothing but the various kinds of the diseases. And what is the application part? How can we help in this certain kind of cases? That is nothing but that particular thing is called as a chronotherapy. That is timing will act in this. Chronotherapy is a concept of optimizing the timing of drug administration according to the target receptor or the gene expression to maximize the therapeutic efficiency and minimize the side effects. So at particular time, if the drug is administered at the proper time, that can be increase the efficiency. So there will be a proper healing and the gentle healing and with the minute side effects. And how we employ this particular thing in our system, that is homeopathy. And this particular thing is employed in all other systems also. In modern medicine, there is a this stream is derivation time during that period, and during the periodical onset or the lunar and the full moon and the new moon. At that particular time, if we administer this particular drugs, there will be the drug efficiency will be increased and there will be a fast healing. So, and this stream of the medicine is been very limited, and the further researches has been expected for the proper and the gentle healing. Thank you.
Myself, Dr. Akash Agnimatla, PG 24th batch, Department of Organ of Medicine, JSPS Government Homeopathic Medical College. So, but a research report presented in the form of a poster. And the title of my research is A Study to Assess the Cardiac Health of Individuals by Evaluating Their Lifestyle. And this is the topic which is becoming relevant day by day. This research was done 4 years back, yet till now it remains relevant to the field. And this emerging field where we diagnose the cardiac health of the individuals even before the symptoms is known as preventive cardiology, and this is a small step that I have taken in my UG. So the purpose of the study. Hello? Okay. So the purpose of the study to identify the predisposing factors that derange cardiac health and create awareness among individuals on their lifestyle choices and to assess the cardiac health of the individuals. So this is the purpose. And coming to the methodology section, the research follows the pattern of a cross-sectional study, the observational cross-sectional one, whereby we collect the data from the individuals and analyze it. We collect the data of the individuals with the help of a pre-designed questionnaire on the lifestyle, which contains questions related to their food habits, their dietary patterns, their sedentary lifestyle, their exercise, alcohol intake, sleep, smoking, and etc. And the scores obtained through the questionnaire are graded into 3 phases: the good phase, the transitory, and the risky phase. And when coming to the results, the sample size that I have taken for the study is 240, 120 male and 120 female, ranging from the age groups 20 years to 60 years. And when coming to the results, when the results of the lifestyle questionnaire were performed chi-square test by taking p-value significant as 0.005, the following were deemed significant. Raw and boiled vegetables were significant, fruits, whole grains, physical exercise, reaction to stress, duration of habit of smoking, alcohol duration and alcohol frequency. So the analysis of data at a glance sums up my whole research in a single image, where I have gathered the 240 sample size and have divided them. The primary objective of this study is to simply reverse the people in the transitory phase to the good phase before they're going into the risky phase. So this is in their hands, and with as we are seeing many high profile deaths, if this intervention be at the right time, we can definitely reverse the transitory phase individuals into the good phase. And the conclusion, by the completion of this research project, it accomplished the following. This research helped to understand the relation between lifestyle habits and cardiac health, and found out that a healthy lifestyle is inversely proportional to the development of CVD, cardiovascular disease. It identified the risk factors that derange cardiac health over a period. And the risk factors identified are lack of physical exercise, smoking for a prolonged period, frequent consumption of alcohol for a prolonged period, not consuming fruits regularly, not consuming whole grains regularly, and not consuming raw or boiled vegetables regularly. So to give you a summary, the preventive cardiology has its roots in world of causes, and only by eradicating the cause can we truly stop CVD from developing over the years. Thank you. And I'm open for any questions. Thank you. Thank you, madam.
Myself, Dr. Prasanna Lakshmi, and I come from JSPS Homeopathic Medical College and PG Scholar of Department of Organ of Medicine. Today I am going to deal with the topic, and I am going to deal with it like temperament, a hereditary component, and emerging for range of diseases. So we have seen that lot of things nowadays. The most underrated thing is nothing but the emotion. People doesn't give any value to the emotions, but these emotions are nothing but causing the diseases. And we were like not well versed about that emotions can also be evaluated, emotions can also be ranked. So through this thing we will be knowing about that how the emotions can be ranked in this thing, and I'm going to explain the scientific explanation. Temperament is nothing but how you react to a particular situation, whether it is an anger, joyful, sad, and these are all the emotions that leads to a diseases. So how you react to a situation is what I am going to deal with this, and these emotions are leading to many diseases. So I would like to explain about the genetic study which was conducted, and in that it had shown that the pathway of MEK, ERK and P13AKT MTOR, this is the pathway, hereditary pathway. In this the genes will be transferred, and the genes can be transferred from cell to cell. In that way the emotions will be transmitted from one generation to the another generation in the pattern, like for example her father or mother who are maybe the anger constitution, these emotions can also be transferred to the offsprings. And in this pathway the stimuli reaction, synaptic plasty and also the synaptoplasty and associative conditioning, these are the two procedures For example, when you want to react to a situation, the synaptoplasty usually transmits the energy or the message from one cell to another cell, whereas the associative condition is nothing but the response, how you react to a situation. That is, for example, anger response, sad response. These response will be transmitted through associative conditioning. And when coming to the physiology, so the main hypothalamus, amygdala and the pineal gland, these will be responsible for transmitting the emotions. So whenever we see there is a research conducted by Lauren on a human-based experiment, and when we see any bad event or the traumatic experience, these emotion will be carried from the eyesight to visual cortex, and from visual cortex it will be transmitted to the hypothalamus through the messenger nerve cells, and from hypothalamus the message will be sending to the glands, that is adrenal gland, which shows fight or flight response, means to respond to a situation. So after the flight or fight response, that is adrenaline and noradrenaline, these hormones will react to physiological changes in the body, that is increasing the heart rate, respiratory rate, becoming the cold climbing. For example, if you see a fearful situation, there will be a bodily changes in the body. These changes will lead to increase in the pituitary gland hormones. By pituitary gland hormones, we all know thyroid hormones and all these, which leading to many other diseases, autoimmune diseases. So these hormones, by increasing or decreasing, causes various diseases. So it is scientifically proven. So and the hormone that is responsible is 17-hydroxycorticosteroid hormone, which is responsible for producing positive emotions and negative emotions. These positive emotions like being confident, healthy, joyful, these are the positive emotions. The positive emotions doesn't cause any disease, but coming to fear, anger and sad, these negative emotions usually raises the 17-hydroxycorticosteroid hormone levels, which leads to the diseases. And there was a study shown that increased IgA levels by the negative hormones, which leads to many autoimmune disorders like SLE diseases. Now we have seen rheumatoid arthritis, SLE diseases, and all these autoimmune diseases are raised by increased IgA levels. So we can say that emotions are nowadays can be evaluated and they can be shown scientifically, and these are only the main source which will be leading to many range of diseases. And the future is the homeopath who treats as a person as a holistic approach, who consider mental, physical, social well-being as a holistic approach. So when we know how the person react, how his nature is, we will be able to treat the disease very easily. So these are the four temperaments: sanguine, choleric and melancholic, phlegmatic. Sanguine is, we can see the range of diseases. So these are the most emerging diseases. Yeah, thank you. And I would like to thank our Professor Dr. Srinivasulu sir for giving the valuable inputs, and thank you Swasthya.
Good evening one and all. Sorry for the glitch for the previous one. Actually my topic was based on nanoparticles. So as you all know, nanoparticles are having wide range of applications in the field of biomedical application. Now, like we just made an effort to synthesize these nanoparticles from the plant called Egbolium ligustrinum. Actually, this is a plant which we find on the roadsides. So this plant was collected and then the extract was made for that, for the synthesis of nanoparticles. So then these are the natural, these are the available applications of nanoparticles presently. Now how we synthesize these nanoparticles from this plant, we'll just go through the PPT. First, this is the actual method of leaf extract. We have collected the leaf and then we have washed it, and then we have just made it to boil with water for 10 minutes, and then this solution of this leaf is again added to the silver nitrate solution. That means nanoparticles, silver nanoparticles, in order to produce the silver nanoparticles. So this was the actual procedure where the leaf extract using silver nitrate was done. So if you go through this PPT, this was the actual leaf extract which was transparent when we go with silver nitrate, and then when this leaf extract was boiled for 2 hours, there was change in the color. If we see the color, this is transparent solution and this is a brown color solution. It is after adding silver nitrate or after the formation of silver nanoparticles, which indicates the change in the color before and after. So now this extract was analyzed by 4 methods: UV method, FTIR method, and then fluorimetry method and particle size analysis. The graph which is displayed here shows the UV method, where surface plasmon resonance will be taking place. Based upon the surface plasma resonance method, there will be change in the color of the silver nanoparticles that is represented on this graph. So based upon the time duration, when the UV analysis is done, the line indicates different colors. So the last one indicates the formation of complete silver nanoparticles with the help of a leaf extract, that is at 2 hours of time. So this is the actual discussion regarding the UV. In this, we just go through the word called surface plasmon resonance, where this resonance, this is a technique where depending upon the formation of silver nanoparticles, based upon the time, there will be change in the formation of colors of silver nanoparticles. The next technique will be here, fluorimetry technique. In this fluorimetric technique, we'll just go through the intensity of the nanoparticles or intensity of the analysis. So we'll just compare the intensity or the frequency of this plant extract, actual silver nitrate solution, and also the silver nanoparticles which are formed. So when we go through the graphs, it is observed that into this graph, the 3346 bond exhibits NH bond, and then coming to the fingerprint region where 562 indicates the formation of C double bond OH bond. So based upon this FTIR graph, we can justify that the functional groups which are present in the glycosides of that plant extract has been extracted into the nanoparticles that are extracted from the leaf. And the last one will be particle size analysis. Basically, nanoparticles will be from the range of 1 to 100 nanometers. So when we go with the particle size analysis, when we go through the graph, ST standard deviation, where the particle size of these nanoparticles which are synthesized from the leaf were of 48 nanometers. Previous. And then this is a graph which is representing the zeta potential, where the zeta potential was found to be 27 million volts. So this, based upon these 4 categories, that is UV, FTIR, fluorimetry and zeta potential, and then particle size analysis, the leaf which is used for the extraction of silver nanoparticles can be used for the further biomedical applications in the cure of any ailment. Thank you for giving me this opportunity.
Good evening, one and all. As far as all the presentees was done their job well, and of course, because they have tried in Ayurveda for several researches, it is very good initiation. But the thing is, somewhat the areas where they have presented is not the research was done up to optimum as per as the clinical, because so many pharma background was there, but you have to be interact with the patients before starting the clinical trial. That is the most essential things while you are going to do any of the research, because directly selecting the topic, and because that lacunas we are observing in each of the presentees. And most of the areas where the isolation and characterization of herbal colors, because right now it is in current modern medicine, what they have designed in the color aspects in certain areas, they are because it is not highly innovative even in Ayurveda, because right now so many companies are designing very well mode. But as far as the science concerned, as per Ayurveda also, in the Shastra was not recommended any colors. As far as our convenience, we are introducing such a things, because most of the areas, the colors are damaging our so much of cell media, because it is already proven. So that's why even which of the colors are the pigments is highly natural, and such a substances, if you go for Haridra, that is Kurkuma Langa, that is having it is a natural color. So in such a mode, if you are selecting the researches, it is highly innovative. And anyway, they have done their job well. And also Ajaya also has presented nice, and it is very good, because we have thought that Tuja is only one spectrum of condition, but some more other condition like fungal media, how it was clinically, they have done any trials or not, we don't know. But the clinical presentation, all the time it is highly recommended in this particular stages. Because the mechanism of doing the things, methods is different, but the clinical aspect, how the drug is effective, it should be, we have to be noticed much. And also Alzheimer's, that is somewhat a little controversy, because have you induced the Alzheimer's, because in the rats how the Alzheimer's was taken, and how you have to induce such a drug and all. There is, and also Dhanvantaram Dhanadhanyadi Kashaya, because what you have selected, Dhanadhanyadi is recommended orally, that Kashaya. It's not giving as a natural nasal media. And also the thing is, nasal media, some of the churnas, that means inhalation wise powders was that is called Mapana Nashya. So that drugs also was there. Before you are starting this, in what more modalities under the process, you have to be checked, because as per as the even scientific media also, if you are because it is Uttamanga of Sira, Dhara is nasal area. So if you give any of the drug towards the brain, it reaches definitely, but in that drugs also, so many drugs was mentioned as Nashya form, the Thaila formation, that is oily media, because the lipo media, because lipolytic action is somewhat different than the other areas. So because blood-brain barrier are crossing in this lipomedia, so many researches already was done. If you are starting such a researches, you have to see our Ayurvedic researches also, and most of the lipid metabolism conditions are somewhat activating the brains is already proven. That's why so many drugs what we are using for the brain, that is the media we are using in the form of sneha, that means in the lipid forms. So even churnas also is there. So with this, because of the time, I have to explain so many things. And also last present also, that is also, it's very innovative to all other sciences also, because even so much of raw we are using as a media of kashaya, and even in the form of syrup and tablets. If you reduce in the nanoparticles, it is highly innovative. It is all welcome to the science. With this concluding methods, because already the main keynote speaker also has spoke very nice, because it is nothing but in our Shastra, Samadosh Samagnischa Samadhatu Malakriya. So if you balance our doshas, body, mind and soul in balancing way, so that is the anthropologist also has explained in the modern wise, because already it was there in our science, very ancient. With this I am recommending, and I am giving, it's not the critics that what we have done, but you have to be motivated to choose, and you have to give better inputs to your juniors. With this, thank you, one and all.
Sir, Next, I invite Malati Shyamla Madam to give her concluding remarks.
A very good session I have experienced. All they have presented very well. I know how much they have taken a pain to prepare all the slides. It is not a joke. It is not that easy to prepare the slides in a schematic way to represent and make the other person to understand our views. It is very difficult to make it all the slides, but all the people, they have done an excellent job. I congratulate and I appreciate everybody about this. And the way of presentations is different, and the way of what I can say is the slide preparation is different. So right now what I have concluded means, with all observation, the Ajaya is a girl has prepared very well and presented. I came to know, I am very, I don't know about the medicines and all, because being a naturopath, I am not come across all those things. But I heard about the Tuja is a medicine that we can take orally and all. But the first time I am observed that even the plants also can be used, the Tuja, and that can be, the fungal infections can be treated in that way. It's a very good presentation. And then Sneha also presented very well. The preparation of the slides is very excellent, up to the mark. The Sneha prepared the slides is very excellent, up to the mark, and they have prepared very well. And once again I congratulate all. They have done a lot of effort to get to this stage. So very excellent. And poster presentation also very nice, though they talk about other persons, but the presentations of that blue shirt person, I don't know, the doctor, Akash, excellent, very sweet and short, all the things they have concluded in one slide. I appreciate really, I congratulate. Thank you for giving this opportunity, the Expo, the organizers. I am very much thankful to give this. Thank you, ma'am. Thank you, sir.
Officially. ఇందాకే మీరు ఇండికేషన్స్ ఇచ్చారు, స్టిల్ విన్నర్ ఒకటి చెప్తాను.
Okay. Today's winner is Ajaya. వెళ్ళిపోయింది అనుకుంటా అమ్మాయి. అంటే చాలామంది అనుకుంటారు నాది అయిపోయింది కదా నేను వెళ్ళిపోవచ్చు అనుకుంటారు. పాపం పక్కన వాళ్ళని విందామని ఎవరు అనుకోరు, వాళ్ళని ఎంకరేజ్ చేద్దామని అనుకోరు. దిస్ ఇస్ ఎ డ్రాబ్యాక్ ఇన్ అవర్ ఎస్పెషల్లీ ఇన్ ఆయుష్ సిస్టమ్స్. నేను ఐఎమ్ ఆల్సో ఆయుష్ డాక్టర్ కదా, న్యాచురోపతి డాక్టర్. I observe in many seminars, many like this. I observe, మనది అయిపోయిందంటే మనం వెళ్ళిపోదాము, ఇంకొకళ్ళని ఎంకరేజ్ చేద్దామని ఎవ్వరు అనుకోరు. బట్ ఎనీవే ఐ కంగ్రాచులేట్ హర్. ఓకే, థ్యాంక్ యూ. బట్ ఉండుంటే బాగుండేది. షీ వుడ్ హ్యావ్ హర్డ్. యా అదే, ఆమె విన్ అయిందని ఆమె విన్నుంటే చాలా సంతోషపడేది. బట్ ఎనీవే, కంగ్రాచులేషన్స్ నెక్స్ట్ ఆల్. ఓకే, థ్యాంక్ యూ.
The certificates, please stay back for the group photo. First, Swati. I request Malati Shyamla Madam to give the certificates. Coach. Okay. Sir, please join me. Dr. Anusha. Dr. Prasanna Lakshmi. Dr. Leela Gayatri. Leela Madri, sorry. I request Dr. Kalpana and Dr. Snehalata to come on to the dais to felicitate the guests. Dr. Kalpana felicitating Dr. Malti Shyamla garu. Dr. Snehalata felicitating Dr. Harshvardhan garu. Dr. Kalpana is felicitating Dr. Venkatramana garu. Thank you. And come on to the dais for a group photo.
1 second. Dr. Anita will felicitate our coordinator, Dr. Himabala.